Ranking Member Senator Wyden for his opening remarks.
Thank you very much, Mr. Chairman. Our nominee would oversee the Centers for Medicare and Medicaid Services and be responsible for the health and well-being of over 160 million Americans. Now, once again, Finance Committee investigators start the process by bringing the receipts. Dr. Oz is the second Trump nominee to come before the committee this year with a record of dodging Medicare and Social Security taxes. This tax loophole hurts Medicare and has benefited Dr. Oz by $440,000 in the last 3 years. Now, the doctor will testify about his concern for Medicare's well-being, yet he is unwilling to pay the same taxes that millions of Americans pay out of every paycheck. So what that means is the person who's nominated to run Medicare thinks that it's acceptable to not pay his taxes into Social Security and Medicare like nurses and firefighters do out of every paycheck. That's number one. Number two, the nominee has been a big promoter of private for-profit health insurance that too often displays little interest in protecting older people who enroll in these plans. And I have seen it as the former director of the Oregon Gray Panthers. So on our side, we're especially concerned that seniors signing up for these plans are being lured by deceptive marketing and too good to be true benefit packages. Then they get walloped by business practices that often delay and deny care. When he ran for the Senate, Dr. Oz proposed putting all seniors into private Medicare Advantage plans, leaving traditional Medicare, which serves almost half the Medicare population. Those folks, their coverage would just wither on the vine. Traditional Medicare. Dr. Oz has demonstrated no interest at all in improving traditional Medicare for the 34 million Americans that count on this program. That'll be a big priority for us going forward. Dr. Oz has made a lucrative career out of advertising these for-profit insurance options, targeting seniors with shady marketing tactics on his television program. He even went so far as to sign up to be an insurance salesman himself. Dr. Oz has used this program to promote some of the most ludicrous wellness grifting that I've heard about to date. Green coffee extract, raspberry ketones, supplements for cancer prevention. Several weeks ago, this committee heard a slew of similarly misleading claims from another unqualified Trump nominee. Now our country is facing the biggest measles outbreak in decades, while the Trump administration touts the benefits of cod liver oil and terrifies parents about vaccinating their kids. Meanwhile, Donald Trump, Elon Musk, and congressional Republicans are gearing up to deal the biggest blow to Medicaid in history. These cuts to Medicaid are going to be devastating for adults and those with disabilities. It could destroy care in nursing homes as we know it. And it's going to mean ripping health insurance away from millions of families struggling to get by. So if confirmed, Dr. Oz is going to be responsible for executing whatever destruction is brought down on the Medicaid program by the cuts Republicans are preparing to make. He would be responsible for the premium hikes for families who purchase their own health insurance through the Affordable Care Act. Dr. Oz would be in charge of these programs. He'd be calling the shots about what gets cut and what stays. He'd be the one to allow or stop any attempts by Elon Musk and his Doge brigade to control Medicare and Medicaid payment systems. Meanwhile, Republicans and those like Dr. Oz are all too happy to ignore the predatory tactics for for-profit insurers that they use to deny and delay care for patients who are trying just to get decent and good quality care. Families across the country want to know that their health care is going to be protected and that premiums are affordable. Instead, Republicans march ahead with plans to take an axe to health insurance. They want to put for-profit insurance companies and private equity firms that make money off denying and delaying coverage in the driver's seat of America's health care. That's not what the American people voted for. It's not what they deserve. Based on the evidence I've just laid out, the American people have a variety of reasons to believe Dr. Oz will be fully on board with the Trump and Republican effort to cut Medicaid and to coddle the for-profit insurance companies. Today's hearing is an opportunity for Dr. Oz to show the committee otherwise. Thank you, Ms. Chairman.